This is Colleen Fitzwater from the Lobular Breast Cancer Alliance. Today I am with Dr. Jason Mouabbi, who recently became a member of our Scientific Advisory Board. Dr. Mouabbi is an assistant professor in the Department of Breast Medical Oncology at the University of Texas MD Anderson Cancer Center in Houston. Dr. Mouabbi, welcome to LBCA Scientific Advisory Board.
Thank you, Colleen. I'm very happy to be here.
Can you tell everyone watching today about your background?
Definitely. So initially, I trained in Detroit, Michigan. And over there, when I decided to start doing hematology oncology, I developed a deep interest in breast medical oncology. And then I decided to further my career and my training by moving to the Texas Medical Center. And initially, I moved to Baylor and worked with the group over there. And during my time there, I started getting more and more interested in lobular breast cancer. And then I decided to move to MD Anderson, where now I am heavily involved in lobular breast cancer research and seeing lobular breast cancer patients.
Thank you. So why did you decide to focus your work specifically on lobular breast cancer?
Thank you for this amazing question. So it never sat well with me that lobular breast cancer patient and ductal breast cancer patient were grouped together and studied together as one entity. And thankfully, over the past few years, there have been a lot of spotlight, thanks to the LBCA and thanks to other researchers like myself that are interested in lobular breast cancer, that shed the light on this difference between those two. So I always felt lobular has to be studied by itself. And I'm glad right now we have Advocacy to help us achieve that goal.
Wonderful. So tell me about, with your clinical practice, about what's the proportion of people with ILC that you were seeing?
So we see right now, my practice is a little bit different, but usually for a breast medical oncologist, the lobular breast cancer patients are between 10 to 15% of patients. Now, because I am dedicated for lobular breast cancers, I start getting most of the new patients that come to us with lobular cancer to my practice. So now my practice, I would say, is around 50 to 60% lobular breast cancer patients.
What do you hope to accomplish through your focus on ILC research?
So for ILC research, there is a lot that needs to be studied, and it's been understudied for a long time. But what we really need to start with are two things. So the first one is we need to have better tools to diagnose lobular breast cancer and to know the extent of disease, both in the early setting and in the metastatic setting. And that's involved imaging. And that's one of the areas that I'm really focusing on right now to better detect lobular breast cancer. The second point is to tailor a therapeutic agent that we currently have for breast cancer for our lobular patients, because like we said earlier, most of those studies were done mixing lobular and ductal, but they were driven really by the ductal cancer patient because they constituted 90% of the patient population on those studies. So right now, this is another area I'm focusing on, is tailoring therapies to lobular cancer, seeing what works and what doesn't work.
Are there things in the near future that you hope to continue your studying in the area of lobular breast cancer?
So yeah, so all cancers start happening at the genetic level. So there is some genetic mutations, what we call our driver mutations, because these are driving the cancer growth. So I am focusing really on that aspect in terms of developing new therapies, what we call targeted therapies against those genetic mutation. And that's one of the studies that we have ongoing right now, that we are trying to mask all those mutations and try to find therapies that can target those specific mutations.
Why is this type of research needed, and why is it so important?
So lobular breast cancer, although we keep saying it's a small proportion of breast cancer, however, it is a big proportion of general female cancers. So if you separate lobular and ductal, the most common breast cancer incidence in females will be ductal. The most common cancer would be a ductal breast cancer. But then if you look at the lobular, it will be the 5th or 6th most common breast cancer. So it's already as common as ovarian cancer and more common, double the incidence of cervical cancer. All those cancer, ovarian cancer and cervical cancer, are studied separately, and lobular cancer has to be studied separately. It has a high incidence. It does not resemble ductal. We know now from studies looking retrospectively back in time that the response between lobular and ductal are different. So at this point in time, moving forward, we should study lobular cancers by themselves, or at least if we're going to group lobular and ductal cancer patients together, we need to power those studies to be able to get conclusion from the lobular breast cancer cohort.
Tell me, Dr. Mouabbi, what drew you to the Lobular Breast Cancer Alliance? What made you want to become a member of our scientific advisory board?
A doctor can accomplish so much by himself. We need to have boots on the ground. We need to have patient advocates. We need to have a voice. Lobular Breast Cancer Alliance does an amazing job at bringing people together, making people work, working with persistence and urgency. That's what we need in the field of oncology. We cannot wait for years for stuff to happen. They need to happen now. Lobular Breast Cancer Alliance was the perfect fit for me. It was the excellent fit for me to bring everybody together, both scientists and patients, to work toward one goal, to really study lobular breast cancer and to identify the best therapeutic approach to make this type of breast cancer treatable, curable, and history in the future.
You're saying, let's bring everyone together. A group of those people who want to help are patient advocates, and they want to help with your research. So can you tell me, how have they helped in your research in the past, if they have, or how would you like them to help in the future?
Patient advocacy is a must, and you can get stuff accomplished a lot quicker when patient advocacy are involved, because they are very vocal. They have a noble mission, and we love to have them around anytime we can. I have worked with them before, and I'm looking forward to working with them this time. And I am involving the Lobular Breast Cancer Alliance in all my studies involving lobular breast cancer.
Well, that's really wonderful to hear. So, Dr. Mouabbi, thank you so much. We're so excited to have you a part of our scientific advisory board at LBCA. It was great spending time with you today. Thank you so much for taking time and joining me.
Thank you so much. I'm very happy to be here.